Dr. Leocadio Rodriguez Mañas, Director of the Global Aging Research Network of the International Association for Gerontology and Geriatrics. It is my great pleasure to introduce to all of you this set of webinars focused on the benefits and prescription of physical exercise in older people, jointly to other sponsors, including the Public University of Navarra, the Spanish CIBER on Frailty and Healthy Aging, and the Regional Health Service of Madrid. This course, coordinated and led by Professor Miquel Izquierdo from the Public University of Navarra, will address the general issue of physical exercise in several conditions and diseases, and also in different settings of care and approaches, from prevention to treatment. To achieve this purpose, the course has met an outstanding group of speakers. I would like to take advantage from this opportunity to express them my deepest gratitude. All of them are among the highest experts in the world in their field of interest. Moreover, all of them have led some of the most contributing studies to show the benefits of physical exercise in this group of population, the older people, the way of implementing the programs, and the target populations among this population, with a preferential focus on those who are frail. Recently, many of them have contributed to the document International Exercise Recommendations in Older Adults, Expert Consensus Guidelines, published at the end of the last year in the Journal of Nutrition, Health and Aging. This document, I think, means a true milestone for all of those working with older people. I am pretty sure that this set of webinars will fill some of the expectations of the attendees and will contribute to strengthen the role of IAGG in helping to the provision of the best care to all the citizens. Thank you very much for your interest in this web series.
Hello, I am Miquel Izquierdo, Professor of Physiotherapy and Exercise Science in the Public University of Navarra and the Navarra Biomed in Pamplona, Spain. First of all, I would like to thank Professor Rodriguez Mañas, Director of the Global Aging Research Network and the International Association of Gerontology, to the opportunity to coordinate this seminar, as well as the geriatrics and the panel of experts and professors who will participate in this online seminar entitled Exercise Recommendations in Older Adults, Update State of the Art. Experts are going to talk about the important role that both structured exercise and overall physical activity play as preventive strategies for many chronic diseases, including cardiovascular disease, stroke, diabetes, osteoporosis, and obesity, improvement of mobility, mental health, and quality of life, as well as reduction in mortality, among other benefits. Notably, exercise intervention programs improve the hallmarks of frailty. For example, low body mass, strength, mobility, physical activity level, and energy, as well as cognition, optimizing functional capacity during aging. They also highlight in the manuscript that the role of the exercise in the prevention of disease and the management of several age-related diseases and conditions is increasingly evident, including syndromes for which the benefit of pharmacological treatment is controversial. Despite its multiple benefits, exercise is not fully integrated into geriatric medicine practice. It is still absent from the core training of most geriatricians and other healthcare professionals. Also remark that in an area of complex regenerative medicine, when some scientists are even considering the expansion of human life well beyond its known limits, we must not forget the simple and important messages. Exercise is not just for children and younger adults. People of advanced age can adapt to exercise and deserve to benefit from it. In this regard, we will give you a quick look on the recent international expert consensus guidelines of exercise recommendation in older adults, and finally we will focus on BB-Frail multi-component exercise program. Hope you enjoy it and like it. Thank you very much. Professor Philipe de Souto Barreto is PhD in biocultural anthropology, is Professor of Gerontology and Director of the Institute of Aging in the Gerontopole Toulouse University Hospital, as well as the WHO Collaborating Center on Frailty, Clinical and Geroscience Research and Geriatric Training. He is consultant for the WHO on aging-related topics and has led and participated in international task force on exercise. Philipe contributed to several national and international research projects as PE, local PE, and co-investigation. His projects have been funded by French and European public authorities, research foundations, and the private sector. Dr. Barreto has been invited speaker at the national and international congresses to talk about topics related to aging, physical activity, and exercise. He has published hundreds of papers in prestigious journals as is the editor-in-chief of the Journal of Nutrition, Health, and Aging. The title of the talk is From Epidemiology to Geroscience: Physical Activity, Exercise as Geroprotectors, the Case of Covid-19.
Hi, my name is Philipe de Souto Barreto. I'm a professor at the University Paul Sabatier Toulouse III, and I'm also a researcher in the Gerontopole of the Toulouse University Hospital, which is a WHO collaborating center for frailty, clinical and geroscience research and geriatric training. In the Gerontopole of Toulouse, I'm also the director of the Institute on Aging. And today I will talk about physical activity and exercise from an epidemiology perspective until biological aging and geroscience. And I will use the example of the COVID-19 pandemic to show the links between physical activity, exercise, and geroscience. So first of all, I have no conflicts of interest to disclose related with this presentation. When we think about physical activity and exercise from an epidemiological perspective and its association with the different health outcomes during the aging process, we know that there is a huge literature, scientific literature on this topic, evidencing the benefits of physical activity and exercise. And here you have a publication done a few years ago in The Lancet, and using data of the global burden of the disease study, this huge initiative that is performed worldwide to look at the different risk factors and burden of risk factors and diseases around the world. And you can see here that in the year 2017, the global burden of disease study indicated that more than 1 million deaths in the world were attributable to low levels of physical activity, 1,260,000 deaths in this year. And this represents an increase of more than 20% in the burden of physical inactivity over a decade between 2007 and 2017. In terms of the development of the different age-related diseases, there is also a good literature on this topic showing that physical activity reduce the risk of developing, in this example here, ischemic stroke, ischemic heart disease, diabetes, and 2 types of cancers. You can see, as you can see in the figure and also in the table, what's interesting to highlight is that the most important benefit, the most important reduction in the risk of developing this disease occurs in the very beginning of the spectrum of physical activity, which means, in other words, that when people stop being totally sedentary and start doing some levels of physical activity, it's in this moment that the highest benefits against the development of disease occurs. This is one of the most interesting publications in the field of physical activity and cancer development, made a few years ago and published in JAMA Internal Medicine. And in this investigation, Moore and colleagues showed that people with the very high levels of physical activity, classified in the 19th percentile of physical activity, when compared to those in the very low level of physical activity, people in the lower 10th percentile of physical activity, High physical activity was associated with a reduced risk of developing 15 types of cancers out of the 26 types of cancers investigated in these studies. So this is really a huge benefit of physical activity against the development of several types of cancers. Of course, beyond cancer, the associations of physical activity with cardiometabolic diseases really very well investigated in the literature. And here we have a meta-analysis looking at the associations of total physical activity, but also leisure time physical activity with a reduced the risk of heart failure, as you can see in the graph. And what's important to highlight here is not only that physical activity reduced the risk of heart failure by about 25%, but it's that all the studies used in the meta-analysis are placed in the left side of the graph, which show a consistency in the findings across the studies, and all the studies pointing in the same direction, which means higher levels of physical activity is associated with lower risk of developing heart failure. Another publication more recently using participant individual level data of almost 20 different studies showed that physical activity, low levels of physical activity compared to high levels of physical activity, low levels was associated with an increased risk of developing all type of dementias, but also specifically an increased risk of Alzheimer's disease. And of course, this study also confirmed previous investigations on the increased risk of diabetes, coronary disease, and stroke, so cardiometabolic disease for people with low levels of physical activity compared to higher levels. When we think about what I just showed you previously were the relationship with chronic, age-related chronic diseases, but physical activity and exercise can also be important in the context of infections, which are not chronic disease, but need the good immunological response to combat the disease. And here in the left side, you can see a Cochrane review of randomized controlled trials of exercise showing that exercise was associated with a reduction in the severity of acute respiratory infections in the upper part of the left side, and in the bottom of the left side, you can see also a reduction in the number of days with symptoms of acute respiratory infection. In the right side of the slide, you can see meta-analysis using data of several prospective observational studies with more than 1 million people, showing that physical activity was associated with a reduced risk of developing pneumonia, a risk that is reduced by more than 30%. And once again, if you look at the studies used in this meta-analysis, all of them are placed in the left side of the graph, showing a consistency across studies in the findings. Another meta-analysis also provided very similar results, showing that physical activity was associated with a reduced risk of community-acquired infection, but not only the development of the infection, but also the mortality associated with this infection, which provides an idea about the potential benefits of being physically active for reducing the severity of infections. And even if several associations with very different diseases have been presented previously, by far the adverse health outcome more investigated in the field of aging and physical activity is early mortality. And here I present you one very nice publication made by Arem and colleagues a few years ago in JAMA Internal Medicine, showing a reduction in the risk of early mortality through a dose response association with, in almost overall terms, a higher levels of physical activity leading to a reduced risk of mortality. This trend is just modified at the end of the the physical activity spectrum with people that are extremely active, having an increased risk of mortality. But what I would like to attract your attention here is about the issue that the most important benefits, the moment in which the reduction in the risk of early mortality is the steeper, is in the beginning of the physical activity spectrum, which again shows that when people stop doing nothing, stop doing totally sedentary and start doing some levels of physical activity, they already find benefits against not only disease, but in this case, against early mortality. And the associations and benefits related with physical activity and exercise during the aging process are not only present in people without chronic diseases. People with diseases also can benefit in a similar way, as you can see here in this meta-analysis of prospective observational studies showing that people that have already breast cancer, type 2 diabetes, or ischemic heart disease, these individuals can also benefit from physical activity. With higher levels of physical activity, reduce the risk of mortality in these clinical populations. So these are the very well-known associations of physical activity and exercise from an epidemiological point of view with different age-related diseases and mortality. And all this epidemiological literature leads us to think that physical activity and exercise are associated with the biology of aging. And indeed, the biology of aging and the association with exercise is a field that has been widely investigated in the past few decades. Here you have some of key publications in this field. A publication that I think it's very interesting to look at is the one by Hawley and colleagues published in a very nice journal that's Cell, Integrative Biology of Exercise, that has a very broad view on the potential effects of exercise to reduce, to contribute to be associated with the biology of aging. And all these associations of physical activity with reduced risk of very different diseases such as Alzheimer's disease and cancer, diseases that have very different pathophysiological mechanism and etiology. So all this leads us to think that physical activity and exercise are not only associated with the biology of aging, but they can perhaps modulate the fundamental mechanism of aging, which means they can modify the rates of acceleration of biological age. And this is the basis of the geroscience field. So geroscience field is a very recent field of investigation in the broad field of gerontology and aging that is born from the observation that aging is the major risk factor for a myriad of chronic conditions, disease, and loss of function during aging. Biological aging is something that can be manipulated. And so the geroscience hypothesis that by manipulating biological aging, we can indeed prevent or delay the onset of several chronic conditions, including diseases and function, but also reduce the severity of these conditions. And here in the right side, you have some interesting key publications on this topic. The main aspects of that allowed the geroscience field to be born are related with two main publications. Other publications were also important on this topic, but these two were the main publications that allowed experts to make a systematic approach of the biological aging and to define a set of elements that are the key players in biological aging, the key biological in terms of cellular and molecular elements that lead an organism to age. And as you can see here, these are very, across these two publications, these are very similar key pillars of aging. the most used currently being the one that was published by Lopez Otin and colleagues, and that's called the hallmarks of aging. So the 9 hallmarks of aging are the cellular and molecular mechanisms that leads to biological aging. And what's interesting to see here is that the manipulation of one of these hallmarks can have an effect on the other hallmarks. So if you modify the rates of aging related with one of the hallmarks, you can have also the effects on the other hallmarks and then on the whole organism. And as you can imagine, several investigators have already started looking at how physical activity and exercise could manipulate biological aging and modify then the rates of aging of an organism. And here you have a few of these publications. We can attract your attention to, for example, this systematic review and meta-analysis of randomized controlled trials of exercise showing that aerobic exercise, but not resistance training, only aerobic exercise, was leading to reduction in telomere attrition, so better telomere length, which is an interesting result. Another meta-analysis this time looking at the immunological system showed that people in the exercise group compared to controls had a reduction in the neutrophil count, an increase in immunoglobulin A, and an increase in T cell helpers CD4 plus. All these elements pointing into the direction that people doing exercise were improving, boosting their immunological system. So what about the physical activity and geroscience? Here we have again the 9 hallmarks of aging, and people have already, as I said before, looked at the cellular and molecular mechanism that could mediate the benefits of muscle contraction in physical activity and exercise on the rates of aging. And the most recent publication that attracted my attention is the one by Carapeto and Aguayo Masukato, published in past year, because not only they look at the potential molecular and cellular benefits related with exercise and physical activity, and also the physiological change led by these molecular and cellular change, as you can see in the left side of the figure. But all these have already been showed before. But what I thought it was interesting in this publication is that in the right side of the slide, you can see that the authors highlight the potential central role of the AMPK activity on the mediation of the physical activity and exercise benefits on the rates of aging. So AMPK will be involved mainly in several different cascades related with the hallmarks of aging, most importantly on energy production at the level of the mitochondrial function. And as you can see, the cascades that are developed by the AMPK activity will in a given moment lead to all the hallmarks of aging, as you can see in the bottom of the figure. So this activity will have benefits on not only mitochondrial function, but also the regulated nutrient sensing, cellular senescence, epigenetic modification, and so on. And here in this slide, I just synthesized some of the potential molecular and cellular mechanisms related with each of the different hallmarks of aging, and that are promoted by physical activity and exercise. And you can see here an increased activity of DNA repair for genomic instability, increased activity of the telomerase reverse transcriptase enzyme for telomere attrition, several different epigenetic alterations, including reduction in the activity of the mitochondrial transcription factor, proteostasis, and a decrease in the activity of the target of rapamycin complex 1, an important mechanism of the aging process. Probably one of the most investigated hallmarks of aging in relation with exercise is the regulated nutrient sensing, especially an increase in the cascade and the axis of IGF-1, IGF, muscle protein production and synthesis. The AMPK axis that we have just discussed before with the cascades leading to increased PGC1 production and sestrins and so on. Mitochondrial function with important effect on content and biogenesis of mitochondrial function, redox balance, facilitation of the lipid oxidation instead of glucolytic production of energy, and so on. Cellular senescence, you can see stem cells exhaustion with an improved regeneration of tissues and work of satellite cells in the level of the muscle. And of course, inflammation with a global reduction of an inflammatory environment. But you can say, but what COVID-19 has to do with geroscience and with the link of physical activity and geroscience, since COVID-19 is an infection and not a chronic disease? And indeed, this is data from CDC. Very recently, I took this data from the CDC website showing something that we already know, but it's always nice to look at the data. Showing that the increase in the prevalence of death due to COVID-19 is really sharp in older ages, especially in people 65 and over, as you can see on the graph. People with less than 50 years have a very low prevalence of death due to COVID. This also led other investigators to look at this association between chronological age and COVID-19 severity, and using data from different places such as China, Italy, New York City. Brom's law showed that the increase in deaths related with COVID-19 sharply increasing around the age of 60s, which leads us to think that there is something biologically occurring at that moment. And this observation that severe cases of COVID were really concentrated in older ages led several researchers around the world to advocate for COVID-19 as somehow an age-related disease that could benefit from geroscience approach, which means not only an approach that will focus on the disease itself, but also on the reduction of the rates of aging, biological aging, to combat this infection. And which are all this literature, all these potential links between COVID-19, geroscience, led me to look at the information we have, the data we have for the moment on the associations of physical activity and COVID-19. And first of all, from an epidemiological point of view, let's see what data is showing. So data from literature are showing that physical inactivity or insufficient physical activity levels is associated with increased risk of death by COVID-19 around the world. Using data from the UK Biobank study, a huge study in UK, Hammer and colleagues showed that compared to people that are really physically active, those who are doing no physical activity, very sedentary people, have an increased risk of being hospitalized due to COVID-19, so developing relatively severe infection by COVID-19. This was one of the first investigations on the topic. More recently, Salis and colleagues using data from the US have provided an interesting study showing that compared to people who were consistently active, those who were inconsistently active or inactive, they had an increased risk of hospitalization due to COVID, and also in the left side, and also an increased risk of intensive care unit admission in the right side. But what's also interesting to look at is not just that, is that when comparing people who were totally inactive to people who were inconsistently active, people who were inactive had already an increased probability of being hospitalized due to COVID-19. And similar findings were found in terms of death due to COVID-19, with people being less active have increased the risk of death by COVID-19. And again, totally inactive people had increased probability of dying of COVID-19 when compared to inconsistently active individuals. All this suggests that even low levels of physical activity can already bring some improvements that could eventually protect against the severity of COVID-19. Again, using data from the UK Biobank, Amadi and colleagues showed that not only physical activity, but also sedentary behavior were associated with mortality due to infectious disease, with higher levels of physical activity being associated with lower risk of mortality, and higher levels of sedentary behavior, which means more time spent in a sit position or in a lying position, was associated with an increased risk of mortality by infectious disease. And similar figures were found for mortality related exclusively due to pneumonia, with higher levels of physical activity being associated with lower risk of mortality, and low levels of sedentary behavior being also protective. But when we think about mortality for COVID-19 specifically, only physical activity, not sedentary behavior, was associated with diminished level probability of dying of COVID-19. Maybe the most recent publication on this in this topic was provided very recently in British Journal Sports Medicine, and using data from South Africa, the authors showed that people classified as moderately active and highly active, when compared to those who had low levels of physical activity, they had a decreased risk of several outcomes related with adverse related outcomes related with COVID-19, such as in table 3, admissions for hospital, so hospitalization. Table 4, you can see admissions to intensive care unit. So what's also interesting to look at is that there is kind of dose response association with the higher the level of physical activity, the lower the risk of having adverse health events related with COVID. And this was independent of the statistical approach used with the data, with a Poisson regression or a Bayesian network. Similar findings were found for the risk of ventilation admission and the risk of death due to COVID, with the highest the level of physical activity, the highest from the lowest the risk of developing adverse outcomes. And last study I would like to show you is a new investigation made in the UK with more than 11,000 people with blood sampling, showing that people with the higher levels of physical activity had lower prevalence, lower probability to have being positive to COVID-19 blood. And the authors call light physical exercise, but it's more a walking type of physical activity. So more than 10 hours per week was associated with a reduced probability of being positive to COVID in blood. So all these, the associations of physical activity and exercise with the biology of aging, with the geroscience field, and the epidemiology of physical activity and COVID-19 led our team in Toulouse to think about the role physical activity and exercise could play in the context of the SARS-CoV-2 infection from a geroscience approach. And indeed, most of the benefits that physical activity and exercise may provide to improve the immunologic system should be have an impact, positive impact on SARS-CoV infection, since one of the main clinical aspects of this infection is the well-known cytokine storm that will globally provide a very pro-inflammatory environment, and by this will impact negatively the function of the lung function, but also the function of distant organs such as kidney. And among the potential mechanisms, we can cite that physical activity and exercise will reduce the activity of the vasoconstrictor axis of the renin-angiotensin system, which is the ACE-N2-AT1 receptor, and at the same time will increase the activity of the vasodilator axis of this renin-angiotensin system, which is the ACE2-ANG17 MAS receptor. And it's important to note also that the ACE2 receptor is the receptor used by the SARS-CoV-2 to enter into the cell in the organism. So physical activity and exercise may have a direct effect on this renin-angiotensin system, and other mechanisms that will also contribute to boost the immunologic system and reduce the pro-inflammatory environment that contribute to the severity of COVID-19, such as a reduction in toll-like receptors, in the activity of toll-like receptors, and an increase, as we have already said several times during this presentation, an increase of the AMPK activity and the cascade, and its cascades. More recently, researchers also indicated the potential role of nitric oxide on COVID-19 and the role of physical activity in improving the levels of nitric oxide, since this substance is improved, its activities improved by muscle contraction, and nitric oxide has an important role as a vasodilator, especially in blood vessels. Physical activity also reduce the risk and the severity of chronic conditions that are often associated with very severe cases of COVID-19. And you can think about hypertension, diabetes, obesity, and heart disease. Hypertension being totally and directly linked to the renin-angiotensin functioning system. And all of these diseases are characterized by a pro-inflammatory environment that's in a chronic way, which is called the low-grade inflammation or inflammaging. And physical activity and exercise will help to reduce this low-grade inflammation to better control these levels. But physical activity and exercise has also direct effects on cardiorespiratory fitness, for example, which improvement in lung function and energy balance too. And if we think about all these mechanisms that are related, that will have an impact, positive impact on the immunologic system and anti-inflammatory and inflammatory environment, and we think about the main hallmarks of aging, we can see that all these elements are associated with the hallmark that's called the altered intercellular communication, in other words, the immunological system and inflammation. But all other hallmarks are also important, and I could cite several others, but what I would like to attract the attention here is the potential role also of the mitochondrial function on the COVID-19 pandemic. So physical activity, by improving mitochondrial function, can also contribute to reduce the severity of COVID-19, since physical activity and exercise will improve the reactive oxygen species balance, facilitating the redox balance with an increase in antioxidant effect and a decrease in oxidative stress, and an improvement in mitochondrial respiration, with facilitating, as I said before, the the lipid oxidation instead of glucolytic production of energy, contributing to mitochondrial dynamics, especially increasing in fusion, mitochondrial fusion, increase interferon activity and quality control. And all this will be leading to boost the immunological system. And the associations of physical activity and exercise with mitochondrial function in the context of the COVID-19 has already been investigated by other colleagues. And here you have a very nice recent publication looking at how physical activity and exercise can boost mitochondrial function and then contribute to protect the organism against severe cases of COVID-19. And other than the mechanisms already discussed here, I put in the right side of this slide other mechanisms that are related with the hallmarks of aging, and physical activity and exercise could also benefit the immunological system and the protection against severe cases of COVID-19 by these mechanisms that are mechanisms that would finally reduce the rates of biological aging. So to summarize, the take-home message of this presentation is that physical activity and exercise are powerful geroprotectors, since they are not only associated with biological aging, but they can modulate the hallmarks of aging. And by doing that, physical activity and exercise can modify the rates of aging of an organism. So physical activity and exercise have the potential to prevent and even to treat infectious diseases, including SARS-CoV-2 infection. And the potential mechanisms are probably multiple and probably involve direct and indirect effects, such as effects on the renin-angiotensin system with globally an increase in the vasodilator axis and a decrease in the vasoconstrictor axis, improvements in the cardiorespiratory fitness and then lung function, improvement in the mitochondrial function, especially to facilitate the balance, the redox balance, which will contribute, of course, to reduce the inflammatory environment that is often characterize severe cases of COVID-19 due to the cytokine storm. Also, another mechanism would be through the prevention and control of cardiometabolic disease that are often associated with severe cases of COVID-19. And of course, through global benefits in the rates of aging by acting on the different hallmarks of aging and reducing the rates of biological aging. And here you have just a few elements. All these benefits would increase individuals' resilience to face important stressors, not only infections, not only infection against SARS-CoV-2, but all type of stressors to the organism. And all this taken together leads us to think that increasing physical activity at a population level could be an interesting strategy to prepare current and future pandemic scenarios. So I would like to thank you for your attention. Thank you.